There are several programs that our core facilitates that are of interest to North Carolina State. What we do in terms of helping the work of the state is impacts all kinds of public health needs.
Our core has worked very closely with the HPTN, which is the HIV Prevention Therapy Network, which is actually run and sponsored by FHI. And again, working with other members of other cores, Carol Golan, for example, in the behavioral core, we actually have a project that is looking at women at risk.
We're anxious to be doing as many preventive measures as possible and to be exploring newer preventive measures.
One of the most exciting trials that we're helping with is CAPRISA-004. CAPRISA-004 is a study of an antiretroviral, tenofovir, formulated into a gel to protect women against HIV infection. And if effective, it will be the first intervention that will be shown to be effective in preventing sexual transmission of HIV, and so that's really exciting. So I think our work is really critical, and we're also very unique because we are the only analytical chemistry, clinical pharmacology core in the Centers for AIDS Research.
And then we are involved with CHAVI as a repository, one of 2 in the world, the other one is in South Africa. The idea of it is to try to understand enough about immunology and the virus to make an HIV vaccine. And so the idea of looking at acutes is to say, what did people get infected with first? And so that's what we need to protect against. That's what you really need a vaccine against.
The Malawi site is the main international site for the NIH Center for HIV Vaccine Immunology, called the CHAVI.
And one of the big projects that we were involved with was called the SAFEST study. It was done in Malawi, where now they didn't have anything, and now they can give antiretroviral drugs to people who need it in sub-Saharan Africa especially. But they don't have the money to test their viral load. So how do you know if the drugs are working? And so this study was really to look at, if you just watched for clinical symptoms, like if they got worse, was that good enough to tell if the drugs were working? And what we found was if you do it that way, they develop such high resistance that there's really no alternative drugs for them to take. So if we could get a cheap, easy point-of-care test to look at viral load, that would be huge. Because if you're going to roll out the drugs, you need to have the testing. We're looking at the BAN study in Malawi. It's run by Charlie Vanderhorst, and it's looking at preventing transmission to babies during breastfeeding. As far as clinical trials, another big thing that we've been involved, the BAN study I already talked about, which is sort of the evolving work of trying to figure out how to prevent vertical transmission, which is mother to child, either during pregnancy or during birth or during breastfeeding. And so the earlier trials that we were involved with were trying to figure out how to prevent transmission during birth. And that's where they had the AZT and nevirapine were really successful, and that really dropped it down. The other part of it is the breastfeeding. And in a lot of places in the world, if you don't breastfeed, it's equal chance the baby will die as if they would get HIV if you breastfed. So that's a bad trade-off. If you stop breastfeeding, you have a much higher chance of the baby dying of just diarrhea and things like that. And so it's better to breastfeed and risk getting the HIV than not to breastfeed. And so we really need interventions that address that need, that they have to keep breastfeeding. How are we going to make it safe for the baby? And there's a new study coming up that we're heavily involved with. It's called PROMISE, which is the idea of, again, trying to find the best way of preventing transmission at all those phases. We know how to prevent transmission at birth. How do we prevent transmission before birth and after birth? And so those are big ones. And do we treat the mom? Do we treat the baby? Do we treat them both? What interventions are really going to keep the baby safe?